Now I want to actually look at another procedure that is classified as a pre-operative procedure. That's before they will do an operation for you tomorrow. One of the things they should do is they should actually admit you to the hospital. Okay, they should admit you to the hospital. Okay, so admission to the hospital is actually a pre-operative procedure. Now let's quickly look at why. All right, so admission to the hospital is indeed a pre-operative procedure. Now it has a lot of reasons why you might actually want to admit someone to the hospital before you do an operation for them. Now let's look at the several reasons why. You want to facilitate comprehensive medical evaluation. You want to make sure that you guys will thoroughly see this patient again, reconfirm all the things. Now this will help you know what this patient will need right there in the what do they call it, the theater ward. Okay, ensures timely completion of diagnostic tests. So there are some tests that the labs are actually maybe in the hospital or close by to the hospital. So bringing the patient closer to the hospital environment will give them easier access to these facilities, right? Now the patient is in the hospital environment and it's actually preparing them physically and also psychologically for the surgeries that will be done. It improves coordination amongst surgical, nursing and anesthesia teams. So everybody's seeing the patient and everybody's trying to map out the work they'll be doing to that patient. All right, so key components of pre-operative admission is medical assessment, so full history and physical examination. So they'll access you again, they'll do a lot of diagnostic tests. You see them listed out there: blood tests, ECGs, chest x-rays. All right, then they'll actually still evaluate which type of anesthesia you'll be needing and all of that. So discuss the anesthesia type. Would it be general? Would it be regional? Would it be local? Okay. Then to educate the patient, they take some time, educate you around your condition and around your surgery, possible complications, possibly things you should do, you shouldn't do before the surgery, things you should do after the surgery, and all of that. Logistic preparation. So bed assignment, nurse handover. So that same bed they admitted you after the surgery, if you are needed to stay in the hospital for some time, they bring you back to the same bed, right? So it's just a way of making preparations for you. Okay, so that's the reasons why we call admission to the hospital as a pre-operative procedure.